Medical negligence, an intricate and delicate legal field, deals with healthcare providers not meeting expected standards of care, resulting in harm to the patient. Although the basic principles are alike, the English and Malaysia have notable variations in their approach and legal systems. This video will cover the important components of medical negligence in both legal systems and its application in various cases.
In this video, we will analyze the landmark case of Bolam against Free Hospital Management Committee 1957 that established how a doctor would not be negligent if his protocol was followed by a body of medical professionals. In this first section of the video, we will delve into how this case will be looked upon based on the law in England and Wales. Medical negligence itself was established in the case of Crown against Bateman 1925, where a doctor was held liable for his actions as his failure to discharge his duties resulted in the patient's eventual death. More importantly, there are three key areas that must be distinguished when it comes to medical negligence. Those three key areas being medical advice, meaning the disclosure of risk, treatment, and lastly, diagnosis. In a nutshell, the case of Bolam against Free Hospital Management was about a doctor-to-patient situation where a doctor did not administer relaxant drugs to the patient whilst undergoing an electroconvulsive therapy. This then resulted in the patient suffering a serious fracture. Hence, the patient brought charges. The main issue here was whether the doctor had been negligent in his actions. The doctor, being a skilled professional, would fall under the category according to the standard of care he owes to the plaintiff. This case was ruled in favor of the doctor, as the ratio decidendi stated by Justice McNair was that he is not guilty of negligence if he acted in accordance with a practice accepted as proper by a responsible body of skilled medical men, or men skilled in that particular art, meaning in a medical sense. Furthermore, the Bolam principle therefore created the Bolam test that applied every case related to diagnosis, treatment, and disclosure of risk. Judges used this test as a landmark to decide whether a doctor or skilled medical professional should be held accountable for their actions. A case that I would like to bring up where the Bolam test was applied is the case of Maynard against West Midlands Health Authority, 1984. This case was under the category of treatment where the doctor's clinical judgment was not negligent and it was supported by a competent but minority view. Another key case that I would like to bring up is the case of Sidaway against Board of Governors, Royal Hospital, 1985. This category falls under disclosure of risk, where the patient was not aware of the risk of developing paraplegia after undergoing a spinal injury. The surgeon was then again not negligent in failing to disclose the minor risk, as the risk was only below 1%, which was then added to the Bolam test. These cases actually show how difficult it actually is for patients to bring up charges against a medical professional. The Bolam test made that sure. However, note this. There are changes later made when it comes to the key case of disclosure of risk, which my team member will explain later on. Thank you.
Thank you, Carmen. One of the pivotal developments in this area is the introduction of the Bolito test, which emerged from the case of Bolito and City and Hackney Health Authority in 1997. Now, it is a significant refinement of the Bolam test in the context of professional negligence, particularly medical negligence in English law. This case introduced an important judicial check on the Bolam test, adding a layer of scrutiny to the professional opinion relied upon in defending claims of negligence. It involved a 2-year-old boy who suffered severe brain damage due to respiratory failure. His mother claimed that the doctor's failure to attend and intubate her son was negligent. The defense relied on expert evidence stating that even if the doctor had attended, she would not have intubated the boy, and that this approach was consistent with a responsible body of medical opinion. In giving judgment, Lord Brown Wilkinson said that the court has to be satisfied that the exponents of the body of opinion relied upon can demonstrate that such opinion has a logical basis in particular in cases involving, as they are so often do, the weighing of risk against benefits. The judge, before accepting a body of opinion as being responsible, reasonable, or respectable, will need to be satisfied that in forming their views, the experts have directed their minds to the question of comparative risk and benefits and have reached a defensible conclusion on the matter. Now, the House of Lords confirmed that the Bolam test, but added a crucial exception. They claimed that the expert opinion must be able to withstand logical analysis. This indicates that a court has the authority to dismiss a set of professional views if it deems the views to be unreasonable or without a solid foundation. Therefore, it introduced an additional level to the Bolam test, requiring medical judgments to not only be approved by a competent authority, but also be reasonable and logical. Now, the introduction of the Bolito test marked a significant shift in the approach to medical negligence, as it allowed judicial scrutiny, since the judges had the authority to closely examine medical opinions with greater scrutiny. This ensures that the courts are not simply approving medical practices without question, but are also actively assessing their validity. In addition, it also encourages a continuous improvement within the medical profession, as healthcare providers must ensure that their practices are not only widely accepted, but also reasonable and evidence-based. Other than that, patients are much more protected by the Bolito test, as it ensures that medical opinions are able to withstand logical analysis. It stops inferior practices from being approved solely because of professional support. Now, to sum it all up, the Bolito test has significantly influenced medical negligence lawsuits. This has resulted in a more even-handed stance, a balanced stance, with courts not too reliant on the medical experts, but also not questioning the medical decisions without reason. Maintaining trust in both the medical and legal systems relies heavily on this delicate balance.
Now I'm going to talk about the Montgomery test, which emphasizes on doctors' duty to provide patients with comprehensive information before treatment, which was from the case of Montgomery versus Lanarkshire Health Board. This case involved a woman with diabetes who was advised to deliver vaginally despite carrying a large baby. The doctor did not inform her of the 10% of shoulder dystocia, which was a complication during surgery. Sadly, this complication occurred, causing severe brain damage to the baby. This case highlighted a critical flaw, which the patient wasn't informed of the risk and alternatives, and she couldn't make a truly informed decision. The Supreme Court ruled in favor of the patient, establishing the Montgomery test. So what exactly is the Montgomery test? Simply put, it requires doctors to fulfill their duty to inform patients about significant risks and alternative options related to medical treatment. This empowers patients to actively participate in healthcare decisions. In the case of Spencer versus Hillingdon Hospital, the case undergoes the principle of Montgomery test, which shifts the focus from what doctors typically do to what patients need to know. The Montgomery test emphasizes that the doctors must disclose all relevant information and risk to patients, allowing them to make fully informed decisions about their treatment. It's about prioritizing the patient's right to know and ensuring that they have all the information necessary to make the best choice for their health. Previously, we talked about the Bolam and Bolito test, which set the standard of care. And this test focused on whether a doctor followed the practices of a responsible body of medical profession, even if other reasonable doctors might have done things differently. However, the Montgomery test takes a different approach. It shifts the focus of the patient's right to make informed decisions. It requires doctors to inform patients of any material risks reasonable patients would want to know, rather than just following standard medical practice. This test ensures doctors to provide all relevant information for patients to make informed choices about their treatment, and this makes a shift from a doctor-centered approach to a more patient-centered approach. And the second example is the case of Mills versus Oxford University Hospital. The case found no negligence in the surgical procedure itself. However, the surgeon failed in his duty of informed consent by not disclosing that the glioma likely wasn't causing the claimant's headache. The court determined that if the claimant had been properly informed, he would likely have chosen the traditional procedure, potentially avoiding complications such as a stroke. As a result, while the clinical negligence claim failed, the claim for inadequate informed consent succeeded because the surgeon did not disclose all relevant information. This case highlights the importance of fully informing patients to allow them to make well-informed decisions about their treatment. The Bolam principle asserts that a healthcare professional is not negligent if their actions align with a responsible body of medical opinion, provided they have a logical basis. Here, the court determined that the surgical technique used was not negligent, aligning with the acceptable medical practice, which is the Bolam test. This case also involves the Bolito principle, which refines the Bolam test by requiring that the medical opinions be logically defensible when examined rigorously, and the surgeon's failure to disclose the incident nature of the glioma breached the Montgomery duty of informed consent. Montgomery mandates the patients be informed of material risk and that a reasonable patient would consider significant in their decision-making process. Had the surgeon followed the Montgomery by disclosing all relevant risks and alternatives, including those specific to the chosen techniques, the claimant might have made a different choice, potentially avoiding subsequent stroke. Therefore, while the surgical technique itself was not negligent under the Bolam and Bolito, the failure to provide adequate information for informed consent breached the standard set by the Montgomery. This led to the successful claim of inadequate informed consent.
Thank you, Yasmin. Now I'll be discussing the extent to which the Bolam's test acts as a guiding principle in professional negligence from the Malaysian point of view. The test in determining the standard of care of a professional defendant was established in the landmark case of Bolam against Frine Hospital Management Committee. In this case, the defendant was found not liable as he acted following the standard of care of a reasonable doctor. In this case, the courts established the standard of care required of a professional defendant as an ordinary skilled man exercising and professing to have that special skill. Although the Bolam's test was first applied by the Malaysian courts in the case of Swami against Matthews, it was notably applied in the case of Chin Q against the government of Malaysia and Anor. In this case, the Privy Council had overturned the federal court decision, applying the Bolam's test to determine that the doctor was negligent. The negligence arose due to the administration of a penicillin injection to a maid, despite it being explicitly noted on her patient card that she was allergic to it. The Bolam's test was later applied by the federal courts, as seen in the case of Kao Nan Seng against Nagama and others. Over time, there was a shift in the application of the Bolam's test in regard to medical negligence. Initially, the Bolam's test was applied to medical advice, treatment, and diagnosis. However, following the decision of the High Court of Australia in the landmark case of Roger against Whittaker, the Bolam's test ceased to apply to professional negligence relating to medical advice. In the case of Roger against Whittaker, a woman who lost sight in the right eye underwent eye surgery after extensive consultation with her surgeon. Despite the surgery being performed skillfully, she developed a rare complication, leading to almost total blindness. The surgeon was later sued for failing to warn her of this risk. The court opted not to use the Bolam's test and found that a medical practitioner has a duty to warn the patient of the material risk inherent in the proposed treatment. The judges also further stated that the law should recognize that doctors must inform patients about significant risk associated with their proposed treatments. A risk shall be considered significant if a reasonable person in the patient's situation would consider it important, or if the doctor knows or should have known that this specific patient would consider this risk important. The decision of Roger against Whittaker was adopted by the Malaysian courts in the case of Fu Fiona against Dr. Su Fuk Mun. Now I'll be discussing the application of the Bolam's test, and the Roger and Whittaker test. The application of the decision in Roger and Whittaker has caused confusion about when the Bolam test should be applied. The decision in Fu Fiona, which followed the decision in Whittaker, is limited to providing advice on the material risk of the proposed treatment. The Bolam's test still applies to the diagnosis and treatment of a patient. Additionally, under the Roger and Whittaker test, the courts will decide the proper standard of care by considering the fundamental principle that everyone has the right to make their own decisions about their lives, rather than just relying on the opinion of a medical practitioner, which is suggested by the Bolam's test.
Hi, I'm Hannah, and I will further discuss about the landmark case of Fu Fiona and Dr. Su Fut Moon, 1999. Fu Fiona, the plaintiff, sought medical attention from Dr. Su Fut Moon following an injury. Dr. Su Fut Moon performed surgery on Fu Fiona, which is reported to have resulted in further issues and damages on her health. The plaintiff said that Dr. Su Fut Moon's negligence was to blame for the aggravation of her disease. Regarding whether the medical care received met the appropriate standards of care and whether it is sufficient, the case raised questions. The federal court rulings were in favor of Fu Fiona, the plaintiff, finding that Dr. Su Fut Moon had breached the professional standard of care and that the plaintiff had suffered as a result. For the first time, the court held that the Bolam test was not the sole determinant of the standard of care in medical negligence, particularly in Malaysia. According to the Bolam test, a medical practitioner is not guilty of negligence if he acted in accordance with a practice accepted as proper by a responsible body of skilled medical men skilled in that particular art. However, the court had advocated for a more holistic approach where they also considered whether there was reasonableness and scrutiny of logic behind the medical professional's conduct. This landmark decision highlights the importance of examining the broader context of medical decisions and looking at the bigger picture. Going back, now let us discuss about the Bolam test versus the Roger and Whittaker test. The application of the decision in Roger and Whittaker caused confusion about when and how the Bolam test should be applied. The decision in Fu Fiona, which followed Whittaker, is limited to providing advice on the material risk of proposed treatments. The Bolam test still applies to the diagnosis and the treatment of the patient. Additionally, under Roger and Whittaker test, the courts will decide the proper standard of care by considering fundamental principles that everyone has the right to make their own decisions about their life rather than just relying on the opinion of the medical practitioners.
Thank you, Hannah. Now, I will be talking about the Zohasima case and if Bolam is still in practice and if it's still alive. The lack of certainty of the correct test to establish professional negligence was addressed in the result of the federal court judgment of Fu Fiona v. Dr. Su Vu Wong and concluded with the decision of Zohasima v. Dr. Kapoor. Zohasima, 36 weeks pregnant, chose her doctor as her first respondent. She was rushed to the hospital suffering from abdominal pain and was admitted to the hospital. Subsequently, that morning, Zohasima had suddenly collapsed, suffering from severe bleeding. She was rushed to the operation theater for an emergency cesarean, and at this point of time, the baby was alive and delivered successfully. However, the doctors performed an emergency hysterectomy, discovering Zohasima had ruptured blood vessels located at the placenta. During the hysterectomy, it was discovered the blood vessels had ruptured, which caused the severe bleeding and the eventual collapse. The collapse had led to a sudden and significant loss of oxygen supply to the baby, and as a result, she suffocated and passed away. Based on the evidence presented to the High Court, it was concluded that there was insufficient evidence to determine the defendants breached their duty. The Court of Appeal, by a uniformed verdict, reaffirmed the judgment of the High Court. To help clarify, the federal court shed light on a point of law. Whether the Bolam test or the test in case of Roger v. Whittaker in regard to the standard of care in medical negligence should apply following conflicting decisions of the Court of Appeal in Malaysia and legislative changes in Australia, including the reintroduction of the modified Bolam test. To further establish and resolve the uncertainty as to whether the Bolam test or the Whittaker test should apply, it is determined a contrast must be made between the diagnosis and treatment and the duty to disclose medical advice in regards to the standard of care in professional negligence cases. Nonetheless, the duty of medical advice is in correspondence to the right of self-determination, and the courts will determine whether a patient has been properly informed of the risk in relation to an advised treatment. Therefore, establishing the test in Roger v. Whittaker is restricted only to the advice of risks, but the Bolam test is subject to qualification of Bolito addendum, which helps to determine the standard of care for diagnosis or treatment. As it helps eliminate the responsibility from the courts of resolving disputes they are not equipped to resolve. However, the federal court's decision in Zulhasima was further established by the federal court's decision in Dr. Hari Krishna. As they further cemented the judgment of Zulhasima, the Bolam test, subject to qualification of the Bolito addendum, persists in application to establish professional negligence in medical treatment and in diagnosis, and the implementation of Fu Fiona continues to be applied by the test in Roger v. Whittaker to establish professional negligence in medical advice and the disclosure of risks. In conclusion, the Bolam test remains a fundamental principle in professional negligence in both England, Wales, and Malaysia. Both authorities have developed and incorporated safeguards to ensure professional medical opinions are logical, reasonable, and that patient autonomy is considered, particularly in cases involving informed consent. In Malaysia, a more significant evolution has occurred by prioritizing patient-centered care for disclosure of risk while maintaining the Bolam test with Bolito addendum. These disparities highlight the ongoing evolution of the legal principles and balancing the professional standards of care with patient rights. As the medical world continues to evolve, the guidelines ruling the professional negligence will evolve alongside with, ensuring a dynamic balance between the professional autonomy and consent. Thank you.